Why do doctors use maggots for wound care? Have you ever wondered how something as simple as a maggot can play a role in healing wounds? It might sound surprising, but doctors use maggots for wound care because they are effective in treating chronic wounds that don't heal well with traditional methods. This treatment is known as maggot therapy or maggot debridement therapy. Maggots, specifically the larvae of certain fly species like the greenbottle fly, are introduced into wounds that have not responded to other treatments. These little creatures help by consuming dead and infected tissue, a process called debridement. They secrete enzymes that break down this dead tissue, making it easier for them to eat and remove it from the wound. This process can clean a wound in just a few days. By removing the dead tissue, maggots create an environment that is less friendly for bacteria, which lowers the risk of infection. They also consume bacteria along with the dead tissue, helping to disinfect the wound. This is important because bacteria can form a protective layer called biofilm, making infections harder to treat. Maggot therapy does more than just clean the wound. It also stimulates the healing process. The activity of the maggots encourages the formation of granulation tissue, which is new connective tissue and tiny blood vessels that develop during healing. This helps to reduce the size of the wound and prepares it for further healing steps. Maggot therapy is especially helpful for chronic wounds like diabetic foot ulcers, pressure sores, and post-surgical wounds. Doctors often consider this option when other treatments have failed or when surgery is too risky for the patient. It can reduce the need for antibiotics and decrease the frequency of clinic visits, which is beneficial in emergency situations where resources are limited. From an emergency preparedness standpoint, maggot therapy is a practical and cost-effective option for wound management. It can be particularly useful in disaster scenarios or remote locations where traditional medical supplies may not be available. While trained professionals are needed to apply and monitor the therapy, it can be a helpful tool when conventional methods are not an option. In summary, doctors use maggots in wound care because they effectively remove dead tissue, reduce the risk of infection, and promote healing in difficult-to-treat wounds. This biological approach is a valuable addition to traditional medical care, especially in situations where access to health care is limited.